So in today's topic we are going to deal about abdomen. So talking about abdomen, we have got again anterior abdominal wall, and then after if we approach the interior of the abdomen we will be getting abdominal organs. So we are removing the anterior abdominal wall muscles such as oblique muscles and rectus muscles. So these two are rectus abdominis, and we are removing transverse abdominis muscle. So now we had approached inside the abdominal cavity. So inside the abdominal cavity we have got omentum over here, which are peritoneal folds. So once you remove the peritoneal folds, we will approach the visceral organs which are present in the abdominal cavity. So first we are seeing the upper aspect, that is diaphragm, which is dividing the whole of the cavity into thorax above and below abdomen. So this is the diaphragm. Above we have got thoracic cavity and below we have got abdominal cavity. So now in abdomen we are going to deal about duodenum. So duodenum region or duodenum, it is an organ which is a part of small intestine, and it is the proximal part and a fixed part of small intestine. We have got small intestine three parts such as duodenum, jejunum and ileum. Now we will approach only the duodenal part of small intestine. So before approaching the duodenum, we should know how the organs are oriented to understand the relation of duodenum in a clear way. So anteriorly here we can see the bigger organ, that is liver, with right lobe and left lobe. So first we are going to approach the relation of anterior aspect of duodenum. So before approaching, just remember we have got duodenum with four parts, such as first part, which is horizontally placed, and vertical part again, that is second part, again horizontal part will be seen, that is third part, again an oblique part which is moving upwards, that is fourth part. So I will show you that. First we have got liver over here. So once you remove the liver, we have got gallbladder over here. So we are removing gallbladder. So this is nothing but stomach, as you know already. So this is the stomach region we have. The stomach, it is going to continue as duodenum. So here what we are seeing is first part of duodenum, which is covered by liver, which is present over here, and gallbladder, which we had removed. So anterior relation of first part of duodenum have got liver's part, that is quadrate lobe, and then we have got gallbladder related in the anterior aspect of first part. And then we have got some structures over here, that is this first part, it is going to continue as second part, and the second part continuation we will call that point as, here we will call that point as superior duodenal flexure. So this point is called as superior duodenal flexure, where first part is going to continue as second part. Now we have got a colon present over here which we removed, that is continuation of ascending colon into transverse colon. So while we are approaching the second part, we have got relation anteriorly. First structure what we see here is part of liver, and then we have got transverse colon and some of the coils of small intestine which is present over here, that is nothing but jejunal loops. So we have got loops of small intestine which is seen in the lower part of the second part of duodenum. So these are the relation in the second part of duodenum. So we are removing the coils of jejunum again to approach the other parts. So here you can make out, this is duodenum, the whole highlighted part. First part which is extending from pyloric part of stomach to superior duodenal flexure, and from superior duodenal flexure to inferior duodenal flexure we have got second part, and from the inferior duodenal flexure, and here we will be having the part called, which is going to aorta, will be seen over here, and till the aorta we have got the third part extending. So here you can see the fourth part. Can you make out? So this is fourth part of duodenum. So first part, second part, third part and fourth part of duodenum. It is a C-shaped curve which is going to hold the head of pancreas, uncinate process and neck of pancreas in proper position. So these are the things we are going to deal detailedly now, both in slides and also in a diagrammatic representation, to understand the relation of this duodenal part in detail. So that's all about the duodenum we have to know. So here you can approach the posterior aspect also. So duodenum, it is a C-shaped curve which is going to hold. So if we remove this part, we can approach this clearly. The structures, that is vessels of thoracic region, we are removing. So this is the posterior aspect of posterior aspect of duodenum, and there we will be having kidney and some gonadal vessels and renal vessels all related. So about that I will show you in a separate slides.
So now in this video we are going to deal about the another part of gastrointestinal tract, that is duodenum. So we have seen about stomach, which is going to continue as duodenum, which is a C-shaped curve organ, and this name duodenum, it is derived from Latin corruption of Greek word. That is, we have got a name called duodecadactylus. So from this name it is derived. The meaning of this duodecadactylus is, we will be having the duodenum size or length is equal to the breadth of 12 fingers. So that is the meaning of this word called duodenum. So which is a Latin corruption of Greek word, and length which is equal to breadth of 12 fingers is called as duodecadactylus. Now we are moving on to the description or detailed account of this duodenum. So before going to the detail, we have to know anatomically what shape it will take. So we will have this duodenum. It is having a shape of C-shaped curve. So this is the shape of duodenum we have got. So the stomach part, it is going to end up as pylorus. That pyloric part is going to extend as duodenum. So this is pylorus of stomach, which is going to continue as duodenum, which is again divided into 4 parts. We can divide this into 4 parts, such as this is first part, this is second part, third and fourth part. Now these 4 parts are having their different length size, such as first part it is about 5 cm. Second part, this whole thing is about 8 cm. And the third part, it is about 10 cm. And the fourth part, it will be the smallest, which is 2.5 cm. So this is the whole length of the first, second, third and fourth part of duodenum. Now we are going to see a detailed description of all these parts together. Before going to that, we have got the C-shaped curve which is going to lodge an organ inside it. So the organ which is lodging in the curve of duodenum is pancreas. So we have got pancreas over here, which is lodged in the curve of duodenum. So this is how we have got placement of duodenum with pancreas. Now we will get into detail of each part separately. Now we will move on to first part of duodenum. First part of duodenum. So as I already said, we have got a horizontal smaller part which is having a length of 5 cm is called as first part of duodenum. So it will be like this, which is a continuation of pylorus of stomach, and it is going to continue as second part of duodenum, and the flexure is called as superior duodenal flexure. Superior duodenal flexure. So the extent of first part of duodenum is from the pylorus of stomach to the superior duodenal flexure. So this is considered as first part of duodenum. So this first part, it is directing backwards and upwards towards the right hand side. So stomach will be occupying the left hand side, which is going to end up in the right side as the duodenum, and the first part is going to continue towards the right side by directing backwards. And this first part again have got some relation. So only about the first part relation we are going to see. First we will move on to relations such as first in front. Relation in front of the duodenum. So first we are taking duodenum first part. In front of the duodenum we have got two relations, such as we have got liver over here. So we have got liver, and in liver we have got a part which is related over here, and that is quadrate lobe of liver. We have got quadrate lobe of liver with the fossa for gallbladder. So we have got gallbladder which is going to extend from the liver, that is neck and body of the gallbladder will be related to the anterior aspect of first part of duodenum. So this is gallbladder. So these are the two relations seen in front of the duodenum. So I will summarize again. We have got anteriorly two relations. One is quadrate lobe of liver. Another one is neck and body of gallbladder. Neck and body of gallbladder. So these are the two relations seen in the front aspect of first part of duodenum. Now we will move on to the posterior relation of first part of duodenum. So behind relation we have got duodenum. So posterior aspect we have got some structures related, such as we have got first behind we have got inferior vena cava. First we have got inferior vena cava, which is the most posterior relation. Between the inferior vena cava and the first part of duodenum we have got again structures such as we have got again portal vein related over here. Portal vein, and also we have got a duct in the anterior aspect of portal vein, and that is bile duct. Bile duct, and then we have got a part of artery, that is we have got common hepatic artery over here. From common hepatic artery we have got gastroduodenal artery coming. So this is common hepatic artery. The artery which is arising from this is gastroduodenal artery, and along with this in the posterior aspect we have got relations such as bile duct, portal vein and inferior vena cava. So these are the structures which are related in the posterior aspect of first part of duodenum. So here we are seeing only the first part of duodenum, anterior and posterior relation. Posterior aspect we have got inferior vena cava, portal vein, gastroduodenal artery and bile duct related. So here first part, inferior relation or below relation, if you take, we have got pancreas over here, and the head and body neck of pancreas will be related just below the first part of duodenum. So these all about the details of first part of duodenum we have. Now we will move on to second part of duodenum. So we are going to see about the second part of duodenum now. Second part of duodenum. So here about the second part of duodenum to deal, we have got again, it is a vertical part. So first part what we have is the horizontal part which is about 5 centimeter, and second part if we are taking, we have got continuation of first part by superior duodenal flexure. It is continuing downwards, and that is vertical part, and then we have got again a horizontal part, that is third part. So this whole thing is considered as second part. So it is extending from superior duodenal flexure to inferior duodenal flexure. So this whole thing is considered as second part of duodenum, which is about 8 centimeter in length. And the main relation where this second part is located is, we have got posterior vertebrae related over here, such as L1 vertebra, posteriorly L2 vertebra, and then we have got L3 vertebra. So these are the vertebral relation we have got for this second part of duodenum. Now we will move on to the relations which we have for this part of duodenum. So first we will move on to front relation of this second part of duodenum. So in front relation of second part of duodenum we are going to see. So this is the second part of duodenum, and in front of the second part of duodenum, first we have got relation of liver. So upper part we have got liver related, and in liver we have got duodenal impression. So this aspect is called as duodenal impression of liver, which is related to second part of duodenum. And then in the middle part we have got a colon which is passing horizontally, that is transverse colon, and below the transverse colon we have got some coils which is present downwards, and those coils are coils of jejunum. So these are the structures which are related anterior to the second part of duodenum, such as, I will repeat again, first is duodenal impression of liver, which is seen in the inferior surface of liver, and then second relation is transverse colon, and the third relation is coils of jejunum. So these are the front relation, which are 3 in number, first, second and third relation. Now we will move on to behind relation or posterior relation of this second part. So behind relation of second part of duodenum. So behind we are going to see for the duodenum. Again we have got first relation just behind the second part of duodenum. We have got right kidney related. We have got our right kidney related to the second part of duodenum, and from the right kidney we have got again some vessels emerging, such as renal artery and renal vein. Renal artery and renal vein emerging, and this renal artery and renal vein are going to extend, and before extending we have got one more relation over here, that is inferior vena cava. We have got inferior vena cava which is draining the renal vein, present over the second part, just behind the second part of duodenum. And then we have got again a part of suprarenal gland related. Just above the kidney, right kidney, we have got a small part of suprarenal gland which is also related behind the second part of duodenum. And just below the kidney or behind the kidney we have got a muscle extending, and that muscle is nothing but psoas major muscle. So right side psoas major, right side kidney, right suprarenal and inferior vena cava with right renal vessels are related in the posterior aspect of second part of duodenum. I will repeat again. First relation from above downwards, we have got right suprarenal gland, and then we have got right kidney, we have got inferior vena cava, and we have got renal vessels of right side, right renal vessels, and we have got right psoas major muscle, right psoas major muscle. So these are the structures which are related in the posterior aspect of second part of duodenum. So we have seen front relation and posterior aspect relation, how these structures are related. Now we will move on to the interior of this second part of duodenum. We have got some other important features for this that we will summarize now, such as if you are taking the interior of second part of duodenum, we have got some features. So we have got duodenum with some papillas present over there. So we have got some mucous folds such as circular mucous fold, and we have got plica semicircularis and plica longitudinalis. We will go to the details of those things later. Before going to that, we have got some openings present in the second part interior. Those are nothing but we have got major duodenal papilla, and above 2 cm we have got minor duodenal papilla present. Major duodenal papilla and minor duodenal papilla present. And this major duodenal papilla is nothing but which is going to drain the bile duct from the liver, gallbladder, and then we have got again main pancreatic duct from the pancreas, both joining together and forming a duct, and that is going to drain in or open in major duodenal papilla. Minor duodenal papilla, it is going to open a duct called accessory pancreatic duct. So while studying pancreas, we will go to the details of how these ducts are arising. Now just to understand, we have got the interior with two opening, major and minor duodenal papilla. Major one, it is going to open bile duct and main pancreatic duct, and minor duodenal papilla, it is going to open accessory pancreatic duct. So these are the details of second part of duodenum. So where it is placed, how it is extending, and talking about the front relation, behind relation and interior relation, we have to tell in detail. Now we will move on to third part of duodenum. So we are going to see third part of duodenum. So talking about the third part of duodenum, it is the longest part of the duodenal region. So we have got second part which is going to extend as third part, and it is going to continue as fourth part of duodenum. So this is the third part which is about 10 cm in length, which is extending from inferior duodenal flexure to, we have got aorta over here. So till the posterior aspect we have got aorta, till the extent of aorta we have got this third part extending. So this is aorta. So the extent of third part is from inferior duodenal flexure till the aorta. Now we will move on to the relation of this third part of duodenum. So first we will see the front relation. So relations we are going to see in that first front relation. So we have got again third part alone we are taking. So only the third part we have taken. So the third part anteriorly it is related to vessel with a mesenteric. So we have got superior mesenteric artery and vein, together it is coming and crossing the anterior aspect of third part of duodenum. Along with this we have got the mesentery is also related. So we have got small intestine which is having a peritoneal or ligaments peritoneal relation or peritoneal attachment that we will call as mesentery. So root of the mesentery is also passing in the anterior aspect of third part of duodenum. We are talking about front relation. So in front relation we have got three structure. One is artery, another one is vein, and one is the peritoneal attachment. The artery and vein is nothing but superior mesenteric vessels, and this is root of mesentery. Mesentery is a peritoneal fold of small intestine. So this is how we have got attachment relation of front of third part of duodenum. Now we will move on to relation of posterior aspect. So behind relation we are going to see. Behind the third part we have got again some important structures related. So third part we have got. So third part posterior aspect we have got two tubes, such as we have got aorta, as we already know. So aorta, and just lateral or right side to aorta we have got inferior vena cava. So IVC. So this is posterior relation, sorry for not mentioning it as a dot. And then we have got kidney above. You know, we have got right kidney related to the posterior aspect of second part. So from there we have got ureter arising. So right ureter will be crossing the third part of duodenum posteriorly. And then we have got some vessels such as right gonadal vessels. So we have got right gonadal artery and right gonadal vein. Right gonadal vein. So that also will be related posteriorly. Along with this we have got right psoas major, which is related to the second part, also will be related to the third part. So right psoas major muscle. And then we have got aorta, which is giving origin to inferior mesenteric artery, will be placed here. So inferior mesenteric artery. So these are the structures related on the posterior aspect of third part of duodenum. I will summarize again. We have got first two vessels such as aorta and inferior vena cava. Along with this, from aorta and inferior vena cava we have got the vessels of right side, right gonadal vessels, and an artery arising from aorta, that is inferior mesenteric artery. And then we have got right ureter and right psoas major muscle. So these all are the structures which are seen behind the third part of duodenum. So now we have got posterior relation for third part of duodenum: aorta, inferior vena cava, right gonadal vessel, inferior mesenteric artery, right ureter with right psoas major muscle. And here you can mention we have got above the third part the head and neck of pancreas. You know, in this curve we have got head and neck of pancreas, that also you can mention as above structure. So above we have got pancreas. So I will show you just above we have got pancreas, head and neck of pancreas, pancreas related above. So this is above relation. And below relation we have got some coils of small intestine. So coils of small intestine also will be related. Jejunum especially will be related just below. Above we have got pancreas. So these all about the relation of third part of duodenum. Now we will move on to fourth part of duodenum. So we are going to see about the details of fourth part of duodenum. So in fourth part, we have got three parts which are extending like a C-shaped curve, and from there we have got this fourth part as a smallest part of duodenum. So this is considered as fourth part. This whole thing is fourth part, which is about 2.5 centimeter in length, which is extending from aorta. We have got aorta over here, which is a point where it is going to extend, and it is going to extend upwards and towards the left side, and it is going to continue as jejunum. So duodenum is going to continue as jejunum, and this flexure is called as duodenojejunal flexure. So this is the extent of the fourth part of duodenum from the aorta. So here we have got aorta. From the aorta till the duodenojejunal flexure, we have got the extent of fourth part of duodenum. Now we are going to see details of the relation of this fourth part. The small fourth part we are going to see again front relation, behind relation. So relations in front. So front relation we are going to see first. So in front of the fourth part of duodenum, we have got a part of stomach related anteriorly. We have got stomach, posterior-inferior surface is getting related to the fourth part of duodenum. So in the posterior-inferior relation of stomachs, we have came across with duodenal relation, that is nothing but this fourth part of duodenum. So stomach, posterior-inferior surface will be related to the fourth part of duodenum. Just below that we have got transverse colon. So we have got transverse colon, the flexure related to the fourth part of duodenum. So we have got two relation in the anterior aspect. One is above stomach, posterior inferior surface of stomach, and below we have got transverse colon. These two are the relation in the anterior aspect of fourth part. Now we will move on to behind relation. So behind the fourth part of duodenum, what are the structures related we are going to see. So fourth part of duodenum. So structures related behind are, we have got just outside this fourth part of duodenum, left kidney placed. So the left kidney will be placed somewhere here outside the fourth part, which is not having any connection with this fourth part of duodenum. Now for relation, I am just telling we have got left kidney over here, and from the left kidney we have got left renal vessels emerging. So left renal vessels such as renal artery and renal vein are related to fourth part of duodenum. Just behind the fourth part we have got renal vessels passing. Along with this we have some fibers of diaphragm also taking emergence from here. So left crus of diaphragm, some fibers will be emerging just behind the fourth part of duodenum. And then we have got left gonadal vessels are also going to pass just behind the fourth part of duodenum. Left gonadal vessels. And along with that we have got one more vein which is related, that is inferior mesenteric vein. So all structures are related just behind the fourth part of duodenum. So these are the relations in the posterior aspect of fourth part of duodenum. I will summarize again. We have got left renal vessels and left crus of diaphragm, left gonadal vessels and inferior mesenteric vein. So these are the structures related anteriorly and posteriorly. Now we can term the fourth part right and left relation. Right side we have got pancreas, as you already know. Left side we have got this left kidney related with its left ureter. So these are the details you have to mention to talk about the fourth part of duodenum. Anterior, behind, right and left relation of fourth part of duodenum. Now we will move on to arterial supply of this duodenum. So we have explained about the details of all parts of duodenum. Now we are going to move on to the arterial supply. Arterial supply of duodenum. Talking about the arterial supply, we are dividing this arterial supply for first part separately and for the other part separately. For other parts, so we have got first part, second part, third and fourth part, as you know. So like this we will be having, and inside we have got our pancreas. So pancreas will be related somewhat here, right? So this is pancreas and this is duodenum. So arterial supply is mainly by superior. We have got superior pancreatico-duodenal artery and inferior pancreatico-duodenal artery. Both will get anastomosed near to the groove between pancreas and duodenum. So in this part it is getting anastomosed and it is going to supply whole of the duodenum except first part. So we have got superior pancreatico-duodenal artery, which is dividing into anterior and posterior branch. Same way we have got inferior pancreatico-duodenal artery. So these two arteries, which is inferior pancreatico-duodenal, it is coming from superior mesenteric artery. Superior pancreatico-duodenal, it is coming from gastroduodenal artery. Both will get anastomosis between the groove between duodenum and pancreas, pancreatico-duodenal groove, and it is going to give supply to all this third, second and fourth part of duodenum. The first part is again peculiar because it is going to get its supply from, so sorry, I am showing only the first part. So first part it is going to get its supply separately from end arteries. So here we have got an artery called gastroduodenal artery. So we have got common hepatic artery which is giving gastroduodenal artery and right gastroepiploic artery. Right gastroepiploic artery, and we have got gastroduodenal artery. And this gastroduodenal artery, it is going to give branch superior to the first part of duodenum and it is going to give branch behind the first part of duodenum, and from the right gastroepiploic artery it is getting its branch below the first part of duodenum. So these are the branches which are end arteries supplying the first part of duodenum. I will summarize again. We have got two branches coming out from gastroduodenal artery. One is supraduodenal artery and another one is retroduodenal artery. So this is retroduodenal artery and this is infraduodenal artery, which is a branch of right gastroepiploic artery. So these are the end arteries peculiarly supplying the first part of duodenum. In the supraduodenal artery is otherwise known as artery of Wilkie. So these are the details we have to mention while explaining the arterial supply of duodenum. So all the parts is supplied by anastomosis between superior and inferior pancreatico-duodenal. Only the first part have got peculiar type of arrangement, that is coming from gastroduodenal and right gastroepiploic artery. And talking about veins, all the veins are going to accompany the same arteries. So we have got again same like this, we have got veins accompanying, and these veins at last, so we have got veins accompanying the arteries. So the veins, it is going to, so venous drainage I will mention here only, venous drainage, the accompanying veins to the peculiar arteries are getting drained into superior mesenteric vein or else to portal vein through its tributaries. So this is how venous drainage is going to happen. This corresponding veins are getting drained into superior mesenteric, or else it will drain into portal vein. So this is how it is happening. Now we will move on to the lymphatic and nerve supply of the duodenum part. So we are going to talk about lymphatic drainage. Lymphatic drainage of duodenum. So talking about lymphatic drainage, again it is very simple to remember. We have got duodenum with pancreas. So always both will be having similarity in their lymphatic drainage and arterial supply and all. So this is pancreas, as you know. This is duodenum. Between the pancreas and duodenum, we have got some lymph nodes arranged. We will have lymph nodes arranged between the groove of pancreas and duodenum. So we are calling this lymph nodes as pancreatico-duodenal lymph nodes. Pancreatico-duodenal lymph nodes. So we are having drainage coming from all this are getting drained into this pancreatico-duodenal lymph nodes, and from here it is at last getting drained into another type of nodes which is present in front of the celiac artery, and that is celiac nodes. So at last it is getting drained into celiac nodes. So this is the way of drainage of the lymph from the four parts of duodenum, first to pancreatico-duodenal, then to celiac lymph nodes. Now we will move on to nerve supply of the duodenum. So nerve supply of duodenum. So talking about the nerve supply, we have got sympathetic and parasympathetic. Sympathetic, it is mainly by celiac and superior mesenteric plexus, and parasympathetic, as like other organs, we have got vagus nerve which is supplying the parasympathetic nerve supply. And applied aspect, we know we have got some peptic ulcer cases which is happening in first part of duodenum, and in second part most common case to occur is obstructive pancreatitis. So that is obstructive jaundice will happen in second part. First part is more prone for peptic ulcer. And then we have got some developmental anomalies such as annular type of pancreas. So these are about the details of duodenum we have to know. That is, in developmental anomaly, as I said, annular type of pancreas, it may obstruct the duodenum second part. That's why it is important over here. So these are about the clinical aspect and also about the parts in detail.
So now we will get to see some of these slides which we will deal with duodenum. So talking about duodenum. So duodenum, it is actually a Latin word which is modified form of Greek word, that is duodecadactylus. The word, it means 12 fingers width. So the length of the duodenum is equal to the 12 fingers width. Sorry about the spelling of fingers. And now talking about the location or situation of this duodenum, it is looking like a C-shaped curve which is going to hold the head of pancreas in its concavity, and this is the duodenum what we have in our body. So this is the duodenum part with four parts: first part, second part, third part and fourth part. And talking about the parts, as I said, we have got four parts and each part is going to have different measurements. First part, it is about 2 inches, second part 3 inches, third part 4 inches, which is the larger part of duodenum, and the fourth part is 1 inch. So here we can make out the vertebral level. First part to the fourth part, it is related to L1 to L3 vertebral level, and the second part, which is going to extend from superior duodenal flexure above to the inferior duodenal flexure below. So first part we are going to deal. So talking about first part, it is going to extend from the pyloric part of stomach. Here the stomach part is removed. The terminal part of the stomach, that is, or distal part of the stomach, we will call that as pylorus, which is going to continue as duodenum. So the first part, it is a continuation of pylorus of stomach till the superior duodenal flexure, and then we have got length, as we already discussed, about inches. If we are seeing, it is about 2 inch. So in length, if we are measuring, it is about 5 centimeter. So course, as we said, it is seen in the L1 vertebra from pylorus to the superior duodenal flexure, which is passing rightwards. So then we have got some relation, peritoneal and visceral relation. Talking about peritoneal relation, the proximal part or proximal 1 inch of this duodenum, above is related to lesser omentum and below it is related to greater omentum. Here you can make out, this is first part. Here above it is related to lesser omentum, below it is related to greater omentum. And then we have got distal inch or distal 1 inch, it is retroperitoneal. So it is having, it is just behind the peritoneum, it will be placed. Talking about the relations of viscera such as organs related to it, we have got anteriorly quadrate lobe of liver and gallbladder related, and posteriorly we have got relations of right side, that is gastroduodenal artery. Here you can make out, this is first part, and here we have got a hepatic artery, common hepatic artery, which is giving a branch called gastroduodenal artery. So gastroduodenal artery, bile duct and a vein called portal vein are related posteriorly, and superiorly we have got a relation of this part. So superiorly we have got epibloic foramen, this is the region. This part we will be having relation of epibloic foramen, and inferiorly we have got head and neck of pancreas over here. So here we can make out in this image. So above, this is the epibloic foramen, and here we have got bile duct and gastroduodenal artery coming, and this is portal vein, which are related to the posterior aspect of first part of duodenum. So this is a relation diagram showing the first part of duodenum with 3 important structures passing posteriorly. So here we have got again the first part of duodenum. Above, it is related to epibloic foramen, which is seen over here. So talking about second part of duodenum, it is extending from superior duodenal flexure to inferior duodenal flexure, that is from here to here, and it is about 8 centimeter in length, course, that is passing vertically in the right side. And then we have got relation, both peritoneal and visceral relation. Talking about peritoneal relation, it is retroperitoneal, so it is present behind the peritoneum. And visceral relation, anteriorly we have got 3 important relation. One is right lobe of liver, which is present over here, and then we have got a colon, which is transmitted or which is going to pass in front of the second part, that is the part which is taken out here, ascending colon, which is going to continue as transverse colon, and then we have got root of transverse colon also related. Along with that, coils of small intestine, that is nothing but coils of jejunum, which is related over here, which are removed over this image. So posteriorly we have got relation of right kidney. So this is the part, anterior surface of right kidney will be related, right renal vessels will be related, and inferior vena cava's right edge will be related. This is inferior vena cava, right margin will be related posterior to the second part of duodenum. Along with that, a muscle called right psoas major will be related, and with that we have got right renal pelvis of the kidney also related. So these are the relations of posterior aspect of second part of duodenum. Talking about medial relation, we have got head of the pancreas. Here you can make out head of the pancreas, and we have got bile duct coming from the gallbladder is related over here. Then we have got lateral relation. Laterally we have got right colic flexure. Here you can make out, this is the right colic flexure, which is related lateral to the second part of duodenum. So this is an image showing the second part of duodenum, anterior relation, liver, transverse colon and coils of small intestine, that is jejunum. These are the posterior relation, that is right kidney, right margin of inferior vena cava, and then we have got right renal vessels, right psoas major, and pelvis, right pelvis. So interior of second part is very important because of its some specific features, as we already discussed, that is we have got interior with mucus folds. We have got circular mucus folds present over there, and in that we have got two important papillas, that is major duodenal papilla and minor duodenal papilla. So major duodenal papilla, it is an elevation present posteromedially 8 to 10 cm away from the pyloric part of stomach. So minor duodenal papilla, it is just above 2 cm above the major duodenal papilla, which is again 6 to 8 cm distal to pylorus. In major duodenal papilla, we have got opening of bile duct and main pancreatic duct opening into it. In minor duodenal papilla, we have got accessory pancreatic duct opening into it. So this is main pancreatic duct and bile duct opening in the major duodenal papilla. Here we have got accessory pancreatic duct opening in minor duodenal papilla. So this is the bile duct picture coming from gallbladder and main pancreatic duct, which is piercing the duodenal wall to open in major duodenal papilla. So talking about third part, it is the largest part or lengthiest part of the duodenum, which is going to extend from inferior duodenal flexure to the front of aorta. Here you can make out aorta. Till the front of aorta, we have got a horizontal part of duodenum, that is third part of duodenum. Length is about 10 cm and it is passing, course of it is horizontally passing and going towards the left side. Talking about relation, we have got peritoneal relation. It is nothing but it is also a retroperitoneal part. And visceral relation, if we are talking, we have got anteriorly superior mesenteric vessels, and then we have got root of mesentery, and posteriorly we have got relation of right ureter, and then right psoas major, right gonadal vessels, and inferior vena cava along with abdominal aorta. So right psoas major, inferior vena cava, abdominal aorta. Along with this, we will be having some right gonadal vessels also present with right ureter, and we have got a vessel transmitting from the aorta, that is inferior mesenteric artery, will be also seen over here. So this is the third part. Anteriorly we have got superior mesenteric vessels along with root of mesentery, and posteriorly these all structures, right ureter and right gonadal vessels, right psoas major, inferior vena cava, and aorta with inferior mesenteric artery. So now we are going to see superior relation. It is related to head of pancreas along with uncinate process of pancreas. Inferiorly it is related to coils of jejunum. So these all about the details of third part of duodenum we got. Now we will move on to fourth part, which is the smallest part of duodenum, and it is going to extend from aorta to the duodenojejunal flexure. So this flexure, which is going to continue as jejunum, we will call that as duodenojejunal flexure. Till that we have got fourth part. It is about 2.5 cm in length, and it is going to pass obliquely upwards towards the left side. Talking about relation, we have got peritoneal relation, which is retroperitoneal. It is present behind. And visceral relation, if you are seeing, we have got anteriorly. Structures related are again transverse colon, same like second part, because both the things are vertically placed and it is crossed by transverse colon and transverse mesocolon along with lesser sac of peritoneum and stomach's postero-inferior surface, which are removed over here. So here we have got postero-inferior surface of stomach also related above the fourth part. Posteriorly we have got left sympathetic chain, left psoas major muscle, left renal vessel along with left gonadal vessel and inferior mesenteric vein. All left side structures will be seen related to fourth part of duodenum posteriorly. And then we have got right side related to attachment of root of mesentery and left side related to left kidney and also left ureter. And then we are talking about superiorly it is related to body of pancreas. So here in this image we can make out, this is the posterior relation of fourth part of duodenum, sympathetic chain, psoas major muscle will be seen behind it, and then we have got left renal vessel, which is seen over here, renal artery, and then we have got left gonadal vessels, and inferior mesenteric vein will be seen draining into inferior vena cava. So we have got this duodenojejunal flexure, which is maintained by a muscle called suspensory muscle of duodenum, which is otherwise known as ligament of Treitz. It is a fibromuscular band which is having both fibrous and muscular part in it. It is going to extend from right crus of diaphragm to the duodenojejunal flexure to keep the flexure in proper position. And now talking about blood supply, the duodenum on whole, it is supplied by gastroduodenal branch and also by superior mesenteric artery. Both are giving branches called pancreatico-duodenal artery, which is seen over here. So superior pancreatico-duodenal coming from gastroduodenal and inferior pancreatico-duodenal coming from superior mesenteric artery will divide into anterior and posterior, and then it is going to form an anastomotic chain near to the second part, between the second part of duodenum and head of pancreas to supply the duodenum. Whereas in first part we have got some other branches, such as we have got supraduodenal branch and retroduodenal branch of gastroduodenal artery, which is going to supply the first part alone, and these are end arteries present in the first part. So this is how blood supply will be given. This is gastroduodenal artery with their pancreatico-duodenal branches passing between the head of pancreas and second part of duodenum. Talking about venous drainage, it is drained by splenic vein, superior mesenteric vein and portal vein. Lymphatic drainage, we have got pancreatico-duodenal lymph nodes, and nerve supply, it is by T9 to T10 spinal segments. Parasympathetic, it is by vagus nerve. And then we have got some clinical aspects such as congenital stenosis and obstruction of second part of duodenum, and superior mesenteric artery syndrome, which is caused by which is going to cause duodenal stasis of third part, and mobilization of duodenum and pancreas is by incision along the convex border of duodenum. So this is an image we will get after a barium meal. So a duodenal cap will be seen over first part of duodenum. So these are the details for the duodenum we have to know. So I have shown you a diagrammatic representation also. Just compare and read both the things, slides along with 3D view and also diagrammatic representation, so that we